Hello everyone, this is Dr. Shyam. I welcome you all to my channel Dr. Pharma. And on this video, I will be discussing on COVID-19 protocol, or you can say the guidelines, which is given by ICMR, that is Indian Council of Medical Research, recently. So there can be a ample of questions in our mind if we are vaccinated, whether to go for COVID-19 test or not. So this protocol is this protocol belongs to the adult patient, or you can say for adults. Now, even though you are vaccinated, okay, you have to go for COVID-19 test. After the test, after you have done the COVID-19 test, we will move first for negative part. So when the test is negative, then you need not to worry. But at the same time, you might have some mild symptoms. Although you're having your test is negative and you're having some mild symptoms, so not a problem. You have to go for home quarantine. At the same time, if your symptoms is worsen or getting worse, then you have to again repeat the RT-PCR test. If it is positive, then you have to go for COVID hospital. Now, as I said, your test is negative and then you're having some moderate to severe symptoms, and you're having that individual is having SARI, means severe acute respiratory illness, means any disorder of respiratory system. That may be you can say asthma, or you can say COPD, or you can say bronchiectasis, or many others. At that time, again, the patient needs specific facility, ward facility for that, or you should visit the hospital if you're having difficulty in the symptoms and you are having some disease related to respiratory system. So that is about your negative, when your test is negative. Moving to the positive part. Now you have done the test and you are having your test is positive. You have to see whether you are asymptomatic or symptomatic. I will just tell the difference between asymptomatic and symptomatic. Symptomatic means you are having the symptoms. That may be, that there may be a cough, or can say common cold, headache. There can be a variety of symptoms. Or you might be asymptomatic, means you are not having any symptoms. You are confirmed with positive, but you are not having any symptoms. At that time, what should we do? Okay, let's talk about symptomatic, then I will just relate with that with asymptomatic. In case of symptomatic, there can be again different situation like you might have mild symptoms or moderate or severe. So how can you detect that whether you are having this mild, moderate or severe symptoms? We can just measure the oxygen saturation. So when the oxygen saturation is greater than or equal to 94%, normal is 96, okay? It may vary from 95 to 96. When the oxygen saturation in the blood is greater than or equal to 94%, then it means that you are having a mild symptoms. Or if the oxygen saturation is in between 90 to 93%, then it is called moderate symptoms. So severe means when the oxygen saturation decrease, okay, or declined less than 90%, then you're having a severe symptoms. You need to be more vigilant on that, means you have to take more precaution. So when the oxygen saturation, we can say, is below 93% or 90%, that means moderate or severe symptoms, then you have to visit the COVID hospital, because that may the situation might be critical in that condition. You should not take easily. You have to just visit to the COVID hospital for the treatment. Moving to the mild one, as I said, when the oxygen saturation is greater than or equal to 94%, then it is termed as mild, or you can say that is your mild symptoms. The main perspective is we have to see whether you are having comorbidity or not. Comorbidity means already the patient is having some illness, or you can say disorder. That may be, you can say, diabetes, or you can say hypertension, or you can say chronic kidney disease, the individual may be obese. So you are having mild symptoms, and we have to check whether you are having comorbidity or not. If comorbidity is not there, no, then not a problem. You can just sit for home isolation. You can isolate yourself in home. If comorbidity is there, suppose like some individual will be there, or patient, they are having some other disease condition, again we have to say, if your comorbidity, other ailments or illness has been controlled, again home isolation will be beneficial for you. You can just isolate yourself. If it is uncontrolled, then you have to move to the COVID center, because again that can worsen your other symptoms. If you are having the comorbidities, if you are detected with COVID positive, then that may be the situation might be critical, so you have to visit to the COVID care center. Okay, so this part is clear. Symptomatic part is clear. Coming to asymptomatic part, means you are confirmed with COVID-19 test, like positive, detected with COVID positive, but symptoms is not there. You have to observe whether you are having comorbidity or not. In a similar way, if you are not having comorbidity, not a problem, home isolation can be beneficial for that. If you are having comorbidity, means you are having some other disease condition, as I said, diabetes mellitus, and then hypertension, CKD, again you have to say whether it is controlled or not. As I said here, if comorbidity is controlled, home isolation, you can advise for home isolation, or you can just isolate yourself. If it is uncontrolled, see, in case of I am talking about asymptomatic, if comorbidity is uncontrolled, then you have to visit the COVID care hospital. And so this is the algorithm, or you can say the protocol, which is given by ICMR for the COVID-19 ongoing pandemic. As I said you, even though you are vaccinated, you have to go for COVID-19 test, because we had seen many numerous infections like COVID-19 has reinfected those patients, or I mean to say those individual who has taken a vaccination. So it will be better for you if you do the test, and you can just be confirmed with that. And this is how you can distinguish between positive and negative, and whether you are asymptomatic or symptomatic conditions. And one more important thing is that this protocol may not be beneficial for the children, and then for the pregnant lady. So this algorithm is only for the adults, as I said you in the beginning of the class. So you can follow these protocols, and you can decide whether to isolate yourself in home or whether to visit the hospital. So I hope the information is very helpful and useful. Please don't forget to like, share, subscribe, and comment on my video. Thank you all.